We are honored to be joined by Dr. Darrin Anderson, Sr., CEO of the New Jersey YMCA State Alliance, and Rick Gorab, President and CEO of Metropolitan YMCAs of the Oranges, the largest YMCA in the state. Now, I'm a Montclair YMCA guy, but yours is the biggest, Rick. Hey, let's do this. For those who don't know, I mean, I was just saying before we got on the air, the Y has been for our kids, for my dad, who before he passed, swimming at the Y was a huge part of his life. We're YMCA people. For those who do not know, Rick, how would you describe your Y and why it matters so much in the community?
Well, Ys in general, and our Y in particular, our mission is to strengthen community through youth development, healthy living, and social responsibility. And our Y and all Ys throughout the state are really pillars in their community, providing much needed community services in a normal environment. But I should say, and I'm sure Darrin will add more to the conversation, that the Ys really have stepped up to the occasion without doubt throughout this last 11 months of the pandemic. And we can certainly speak to the various things that the Ys have done throughout the state to really positively impact all the communities throughout New Jersey.
Well said. By the way, we're taping on February 16th. It'll be seen later. And Darrin, let me come back to you because our good friends at Horizon, they support you. They support public broadcasting. They're good in that way. But it brings me to this question, Darrin. Throughout this pandemic, all nonprofits struggle with a lot of areas. One of them is fundraising. How challenging, Darrin?
Well, I think it's challenging across the board for all nonprofits. Look, this is unprecedented. This is the pandemic that has wreaked havoc in our communities, that wreaked havoc in our homes, and has also have wreaked havoc within our organizations. And nonprofits, just like any other entity, we need support. We need community support. We need philanthropic support. We need support from everyone that's willing to donate their time. However, those that usually would volunteer for YMCAs and other organizations are now finding themselves with need that the YMCA is providing, such as food programs, such as emergency childcare, virtual programs. And in fact, many of our facilities was used for not only COVID testing, but also for blood draws. So we really have repurposed our facilities and our resources to meet community needs.
You know, it's so interesting. Darrin mentioned so many emergency services. One of them mentioned childcare. Our longstanding initiative, and our team will put up the graphic in post-production, Reimagine Childcare, the Terrell Fund leading that effort with others. The Y in our town, huge in terms of emergency childcare. Rick, is that part of your Y as well? And who's taking advantage in a good way of those childcare services?
It was definitely a part of our early mobilization to support our community. And Steve, if you don't mind, I want to tell a quick story here, because early on, when we first were able to go out and visit our childcare centers, I happened to come upon one of our centers that happened to be at Livingston, where we were providing emergency care for essential workers. And I was greeted by two of our staff members, and to their right was seemingly a mom, and she was dressed in scrubs. And I was introduced to her by our staff members, and the woman, who I later found out was a nurse, thanked me for what we were doing for her. Now, I was taken aback quite a bit, because here she is saving lives, but the Y was an integral part of allowing her to do that. And it was an amazing moment for me, and it was really telling to then understand the impact our Y was having in Livingston, and Ys were having throughout the state of New Jersey for essential workers.
Well said. Darrin, as I come back to you, let me ask you this. The economics a big part of this in so many ways, but also employment. The Ys employ a lot of people. From your perspective statewide, Dr. Darrin Anderson, have you let people go, A, and B, what would it take to bring some of them back?
You know, just like any other organization, the YMCAs had experienced tremendous economic decline. we're estimating that we probably lost about between 150 to 160 million dollars across the state. That's 32 corporate YMCAs. We had to lay off between 85 to 95% of our staff. So it was
85 to 95% of the staff you had to lay off.
Correct. We were
because they were closed, because Ys were physically closed.
No, well, I think that's one of the misnomers that's out there. Our YMCAs never closed. Our wellness centers were temporarily shut down through the executive order, but our facilities remained up and vibrant. We were still providing essential services to the community.
So even if you couldn't go into the gym, there were other things going on, correct?
Correct. The YMCAs are not just a swimming gym, and it is a place where health and wellness is part of our portfolio, but we are a human services organization. So we're meeting the dire needs of our community regarding food access and emergency supplies and essential things that families needed. Look, we were getting contacted left and right by the community, by the needs that are out there. And COVID not only uncovered more need, but it exacerbated others. And the YMCA stepped up, even when we didn't have the same level of staff. We stepped up and garnered as much support as we could to continue to provide this to the community.
It's so interesting, and I don't take the Y in Montclair for granted, and those who are connected to it, I'm confident, I'm hopeful that they don't. And I don't want to be negative here, but the economics matter. People hear the word nonprofit. We're a not-for-profit production company affiliated with great folks at public broadcasting, but no money, no mission. And again, I know I keep talking about money, but here's why. Do you think people realize what would happen if YMCAs were to, in fact, begin to close down, not just lay people off or struggle financially, but actually, Rick, couldn't exist? Do people have any idea the impact on our communities?
I think the pandemic has exposed a lot of things that are essential in the community. And I think one that has risen to the occasion has been the YMCAs. And I think people, if they weren't aware of the impact and the mission of the Y, I think we have certainly re-emphasized and amplified the third pillar of our mission, and that is social responsibility.
By the way, I'm sorry for interrupting, as we're taping on the 16th of February, 2 million meals in New Jersey delivered by the Y. That's just one example. But go ahead, Rick.
Yeah, 2 million meals, and 750,000 of them were delivered by the Metro Y of the Oranges throughout Western Essex County, Passaic County, Sussex County, Bergen County, and even going into Warren County. And I'm going to build upon this point because
real quick, got a few seconds left.
One thing about the pandemic is that it didn't discriminate. So it didn't matter if you lived in East Orange or Livingston or Wayne or Sussex County. Every single family in New Jersey has been impacted, and the Ys have been there to meet the mission and to meet the moment.
Every day. And so to Rick and Darrin, I want to thank you and all of your colleagues at the YMCA Alliance across the state. We've been blessed in our family, and we're just one of millions of others. Gentlemen, thank you so much. We appreciate the work you're doing.
Thank you, Steve.
Thank you for having us.
I'm Steve Adubato. We thank you so much for watching. We'll see you next time.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, the Turrell Fund, supporting Reimagine Childcare, PNC, Grow Up Great, the New Jersey Education Association, the Healthcare Foundation of New Jersey, Atlantic Health System, New Jersey Sharing Network, NJM Insurance Group, and by Fedway Associates, Inc. Promotional support provided by the New Jersey Business and Industry Association and by New Jersey Globe.
I was diagnosed with cystic fibrosis when I was 2. It's hard to grow up with CF. But I have an awesome care team at Gorab Children's Hospital, helping me do the things I want to do, like play lacrosse. And now I've been recruited to play in college.
Where you go for pediatric care matters.
Atlantic Health System, because every moment is a moment that matters.